Good day. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. I want to talk to you about shoulder pain. Now, shoulder pain, if you got it, it really sucks because a lot of times you can't do certain exercises if you're very active. Um, and it progressively gets worse because it inhibits a lot of different muscles. So sit tight, a lot of information coming at you. First of all, it's important to evaluate all the different muscles during examination. Just take an MRI or an X-ray, say you go to your orthopedic, he says just do physical therapy or take a cortisone shot. Well, if it works, then you really don't need to listen to this, which is great. Don't listen. But what I want to talk to you about is how the exam should go. All right. Obviously, the shoulder pain is going to impact your life. So the case history is going to unveil. You probably have trouble sleeping because when you turn on your shoulder, on your side, your shoulder's going to get irritated, or you can't sleep on that side, or certain movements are going to irritate it. If it's inhibiting exercise, then that's a real big problem for me, as it should be for you, because if you can't exercise, well, life is just not that good if you're not able to exercise because of a shoulder pain. But Advil will relieve, they'll take care of the pain, but it's not going to fix the problem. Identifying which muscle group is involved is very important. A couple muscles that really key in on is latissimus dorsi. It's a huge muscle that goes from basically your armpit down to your lower back on both sides. It's a very, very big muscle, very broad muscle. And a lot of times we'll find that muscle is either short or weak. Another muscle involved most of the time, which I'm going with the most common ones first. Another muscle involved is the deltoid. Now, you should have the deltoid checked because it's three heads. You have the middle head, the forward head, and the back head. We call them anterior and posterior, forward, backwards. A lot of times the middle head of the deltoid is going to be involved. That's the motion where if you held your arm to your side and you turn your arm up, we call it adduction. Abduction. Adduction is when you bring it back. Those are the three. So you have the lat, and the lat could be short and weak. So that's a big problem because the muscle is not functioning properly. And if you restore the normal motion through a process called trigenics, what you're able to do is reintegrate the muscle neurally and kind of correct the link between the tendon of the muscle and the muscle spindle cell. That's a little more complicated than you need to understand. Is what you need to know is there's help for this particular, when you have shoulder pain. Progressive shoulder pain for more than a year typically goes into what we call a frozen shoulder because the muscles stop working in conjunction. So another muscle that we find a lot of times is the supraspinatus, which if you just took your left hand, put it close to your neck and your upper back, right where the shoulder and the neck meet, that's where the supraspinatus comes out. So if you look for those four muscles, the latissimus dorsi being short and weak, middle head of your deltoid being weak, and supraspinatus weak, you can correct that pretty easily and reintegrate. And a lot of times people will see results with just working those two particular muscles using a technique called trigenics. And we're not going to get into the trigenics part, but these work because we're stimulating cells that have both to and from access to the brain via the nerve to the spinal cord to the brain. And when you reintegrate, you take these muscles or tendons through a normal range of motion and you stimulate the muscle spindle cells or the Golgi tendon cells, you're able to reintegrate and get proper movement because you see strength come back. And sometimes you'll see it immediately. Not that you're going to get out of pain immediately, but you'll see a change in strength. And if you can see strength immediately where there was weakness, there's something valid to the whole process. What I want to go on is, but a good shoulder exam should be checking the biceps, the triceps, short head of the triceps, because you have two heads, the triceps, triceps. There's multiple heads. One's got two parts, one's the short part. So it's really just two different parts, three heads, okay? Anatomy is kind of hard to do on a podcast, but so you want to check triceps for strength, short head of triceps. You want to check the infraspinatus, which is one of the muscles involved with rotator cuff injuries. People call it rotator cuff, whatever you call it, it's fine by me. But the infraspinatus as well. Teres major, that's another one involved with rotator cuff, however you want to call it. And then you also have the subscapularis. Subscapularis is the one that goes, if you reached over, took your right hand, go over your back and touch your left shoulder high up. And I'm talking about between the neck and the actual joint, the shoulder joint. That particular area there is where the infraspinatus lies. But also, too, is on the other side of the bone is a subscapularis, which allows us to kind of move the arm in and out. It helps to rotate, as does the teres minor. So let's go over the muscles you should have checked out. And if your doctor's not doing it or your therapist is not doing it, call them on it, okay? So let's just start. Let's go with the supraspinatus. That's the one that comes right out your neck and it goes along the top part of the scapula. Scapula is the bone, that big wing-shaped bone in your back, upper back, part of the shoulder complex. So you want to check these muscles out completely. Supraspinatus, infraspinatus, teres major, teres minor, subscapularis. I already did infraspinatus. Now the other one too would be the deltoids. The deltoids, 3 heads. You need to check all 3 heads. Anterior, middle deltoid, posterior deltoid, because they all have different functions in helping to move the shoulder. And a lot of times what happens with the shoulder is it's really easy to say, okay, you got a tear here. Well, sometimes the tear is there because you have imbalances in the muscle and one muscle has to work harder when you lose normal functioning. So the thing is, there's a way out of chronic shoulder pain. Now, when you have these little tears in the shoulder, what happens is the muscles are not working. They're not working in conjunction with each other as they're supposed to. The covering on your muscle is called your fascia. If you've ever heard the term plantar fasciitis, you kind of get a feel for what I'm talking about. So the shoulder muscles all have a covering called fascia. When they become irritated, or the connection between what I mentioned before, the muscle spindle cells and the Golgi tendon cells is inhibited, well, then the covering on the muscle starts to shrivel. It's not getting the right nerve intervention from the muscle to the spinal cord, to the brain, and actually then to right, if it's your right shoulder, to the left side of your brain that controls the right side of your body. So identifying the key muscle groups is essential. But when you have these micro adhesions, what we call them, an adhesion is, just think of if you took 2 pounds of hamburger meat, you put them in 2 Ziploc bags and you rub them against each other. They're going to move nice and smoothly against each other, right? Now, suppose you took 1 pound of hamburger meat in a Ziploc bag and you put the other in that bubble wrap bag and you rubbed it against each other. You'd be creating friction. And every time you move, you're irritating the surface, the covering. Now, fascia is very nerve-rich, okay? Again, using the analogy about plantar fasciitis, very painful. There's a covering on the muscle starts to shrink, and you start to form micro scar tissue, which we call adhesions. We use a process called shockwave therapy. It's a very popular therapy these days. What it does is it breaks up these adhesions on the surface of the fascia. And what it does also is it allows for increased blood flow. So if you heal the connection between the brain using those muscle spindle cells and the Golgi tendon cells, and then you break up the adhesions, you're going to get a tremendous increase in mobility and a significant decrease in pain. I know I'm throwing a lot at you with this stuff here, but what happens is I see a lot of shoulder cases. I'm a chiropractor, as you know. I'm not just a chiropractor, and what happens here is you have the ability to restore function, because then your physical therapy becomes much more effective. But also, too, is you'll be sleeping better and hopefully exercising more. There's a lot to do to fix a shoulder, but I think what happens a lot of times is people just rely. I got shoulder pain, I'll get an MRI, I got a tear, I got the cortisone shot, feels better. You know, these days, long-term cortisone use is just not indicated anymore because it can really damage the joints in the body over a period of time. I mean, it does weaken the bone matrix because it suppresses everything. So it's kind of the type of thing you want to use sparingly. Like, say you go on a trip and your shoulder hurts and you get a cortisone shot. I get it. You know, if you're an athlete and you're getting paid gazillions of dollars to perform, I get it. But understand there is a way out of chronic shoulder pain. One, you have to restore the neural connection between the affected muscles. And like I said earlier, there's a couple of muscles that are primarily involved, supraspinatus, the middle head of your deltoid, and latissimus dorsi being short and weak. You hone in on those primary ones, strengthen them, you're going to see a significant pain reduction. Now, people say, why would you go to a chiropractor for a shoulder pain? Well, because you're not getting results elsewhere. Not saying that I am the king of shoulders. I've happened to be fortunate enough to learn from the best people out there, and I do a damn good job of fixing shoulders. So, Dr. Brian McKay, Core Health and Darien, you got a question, give me a call. My office number is 203-656-3636. 203-656-3636. If you want, come over for a demo. I have no problem demonstrating a pre and a post where those muscles get strong. And if you like what you see, then try before you buy. I have no problem because I know the results are that good. Now, listen, again, do we help everybody? No. If you've got some kind of rheumatoid arthritis, we're not going to see a big change. And the other thing, too, is the longer you've had something, the longer it takes to fix it. But I can pretty much tell you, Advil, Aleve are not going to fix many shoulder. They'll mitigate shoulder pain for today, but it's not going to fix it later on. I guess that's what your big concern is. Again, Dr. Brian McKay, Core Health Darien, give me a call, 203-656-3636. When you call up, say, listen, I want to come in for a demo. I'm more than happy to spend 15, 20 minutes going over it because it is fun when you see someone's face when they have a lot less pain almost instantaneously. Is it going to be for you? I don't know. Again, 203-656-3636. Give me a jingle. Thanks.